Welcome everybody. We are just going to give people a few minutes to join and then we'll go ahead and get started here today. Hello, welcome. It looks like most folks who are in the waiting room have been able to join, so we're going to go ahead and get started. So first of all, thank you all for being here. There was a significant announcement from the governor last Friday that has an impact on a lot of our local businesses. So we wanted to take an opportunity, first of all, to give you a high-level overview of those changes, and then primarily to provide an opportunity to get your questions answered. This is a Zoom meeting, and you can submit your questions through the Q&A section in the chat box. So if you submit your questions in there, then we will make sure to address them as we go through the presentation. So we are recording this webinar in the hopes that it can provide the information to folks that aren't able to join today, and we can post it out to our website in order to assist those folks. And then we will be updating our website, mynevadacounty.com/corona or /coronavirus/business with new information from the state. So you can find resources out there already, and we'll be updating those resources. If you have additional questions, you can always submit them to our COVID-19 recovery inbox. So that address is covid19recovery@co.nevada.ca.us. And a little bit later in the presentation, I'll put that up on the screen so that you all can take a screen grab of that and easily find it. So first of all, the panelists that we have today, I am Ryan Groover. I'm the county's Health and Human Services Agency Director. Jill, do you want to introduce yourself?
Sure, thanks Ryan. I'm Jill Blake, the Public Health Director. Thanks everybody for coming today.
Thank you, Ryan and Jill. Amy Urani, Environmental Health Director. Thanks everybody for coming.
Great. So we will go ahead and get started. And I do have a PowerPoint presentation that I would like to put up on the screen just to assist in walking through the changes that are coming from the state. And so just get this going here. And Jill and Amy, if you could nod and indicate that you're seeing what's up here. Okay, so the state on Friday, the governor announced what they're calling the blueprint for a safer economy, which is a tiered framework that their hope is really that it's going to carry us through the flu season and the winter months. They feel it's responsive to a lot of the lessons learned over the last several months of this pandemic, as well as responsive to a lot of feedback that they've been hearing throughout this. So first of all, the statewide trends in COVID cases have really peaked in around July 24th, 25th, and since then, with some spikes, have started to taper off somewhat. And so the state really, in order to be responsive to that, we're certainly not at the level that we were very early in the pandemic, but the governor announced a framework that they feel is more granular. A lot of the communities have expressed, well, why in a rural community like Modoc County do we have to have our businesses shut down because of transmission that's going on in a large city? And so they've announced what they feel is a more granular framework that's not one size fits all, that's responsive to conditions on the ground. The degree of openness in a community is dictated by those conditions. It's not an on and off switch, and we'll talk a little bit more about that as we go forward through this. They simplified the criteria. They're not necessarily intuitive, but there's fewer of them, and they're transparent with the data that they're putting out there so that we can see exactly where we fit within the state criteria. And then they've put together a clear process for how you move through different tiers in the framework. And then they described this as a light at the end of the tunnel. So a lot of the feedback that we've certainly been hearing, and they've been hearing it as well throughout this, is that, look, we're sitting here playing a guessing game. We don't know what's going to open next. We don't know how to prepare for that. We don't know what's going to be required of us to reopen. And so they're laying it all out and putting out a framework that shows varying levels from a widespread outbreak all the way to minimal transmission. And so they've put together this color-coded framework that you see on the screen in front of you that starts with purple. So that's widespread, where most non-essential businesses are closed, to substantial, where some non-essential businesses are open to operations, and there's varying levels of operation, then moderate, with more indoor operations with modifications, and then minimal when most businesses are open with modifications. So they've set forth criteria in two broad categories that are applicable to those various tiers. So those criteria relate to new cases, average new cases per day per 100,000 people. So for the widespread category, for example, if you're having more than 7 cases per day per 100,000 over a week-long period, then you're in that highest tier or the most restrictive tier, all the way down to less than 1 case per day per 100,000 would be in the minimal tier. Additionally, the second criteria is the positivity rate. So that's the percentage of tests that are positive within that same 7-day period. You have to meet, if your criteria are within 2 of those tiers, then you as a county fall within the tier that's more restrictive. So you'll see when we get to Nevada County that one of our criteria falls into the moderate tier and one falls into the substantial tier. And so we as a county fall into that substantial tier. Also of note, without getting too wonky, there's a benefit to doing a lot of testing. If we're testing above the state average, they'll actually apply an adjustment factor to the new cases per 100,000 and reduce it down so that we're not penalized by doing a good job of testing. And then, yeah, I'll get a little bit more into the process later. But the state has also introduced this data dashboard. You may be familiar with the interactive map that they had out there previously. And really it was a 2-tier system. There were the counties that were on the monitoring list, and then there were the counties that were not on the monitoring list. Luckily, Nevada County never made it onto the monitoring list. In the new schema, the monitoring list is roughly equivalent to the purple tier. So that would be the widespread category. Approximately 86% of the state falls into that widespread tier. And then around 13% of the state falls into the tier where we are, substantial, and then only 1% falls into the moderate tier, and less than 0.1% fall into the minimal tier. This is the map as it currently stands for the whole state. You'll see the new COVID cases per 100,000 for the state are around 10.9. The positivity rate is around 6. In Nevada County, the metrics, you'll see that we are at 4.1% for new COVID cases per 100,000 and a 2.2% positivity rate. So in terms of those new cases, you may recall from the previous slide that the criteria for going down to moderate was under 4. And so we're right on the cusp there, and we're actually in the moderate category when it comes to that positivity rate. So we're not that far from actually being in that orange category. Significantly, what I'd like to point out here is that some people have been confused by the various data that's out there on the state site, the data that was reported on their map and on their main website was not the same data that was being used for county monitoring. And so they've cleaned that up, and the data that the public will see out in these maps is the same data by which the counties are being placed into tiers. So just a little bit about the process for leveling up between those tiers. So we start at substantial. The process involves a minimum of 21 days within a given category, and that's so that counties aren't bouncing around every single week as new data is released. they're requiring at least 21 days within a category. And then for the 2 consecutive weeks prior to leveling up, you have to have met both criteria for the next level. Then they also announced that they will be applying a health equity measure that has yet to be defined, which is basically designed to ensure that we're not just cherry picking and testing in an area with low transmission, that we're equitably testing across our county, and that disparate groups that have been particularly impacted by COVID-19 are not being left behind as we seek to level up through this. And so that is yet to be defined, and we'll certainly share more information as soon as we have it on that. And then once you've met the criteria for the next criteria for 2 weeks, as long as you've been in your current category for at least 3 weeks, you could level up to the next category, thus opening up additional sectors at additional capacities. So that's the process that they have for leveling up. So just to map that out a little bit. So on today, we were placed into the red category. The data from the state will be updated weekly starting on September 8th. So the first cycle will be a week and a day. Then after 3 weeks of having been in this red category, assuming that we've met both criteria for the next phase for the last 2 weeks of that time frame, we could theoretically advance to the moderate stage as early as, or no sooner than, the 22nd of September. And then each week thereafter on Tuesdays is when they're planning to refresh that data. So just a little bit about how this impacts the sectors, and we'll get a little bit more detailed into the sector by sector, but just in terms of what this looks like, it's not an on-off switch as it used to be so much as a dimmer switch. And we've heard that language used previously by the state, and that's really embraced in this policy. So whereas if you look at shopping centers, malls, destination centers, swap meets as just an example, you'll see a widespread tier 1, they're open indoors with modifications at 25% capacity, closed common areas, closed food courts. If you move on to substantial, they're still open. They're open now to 50% capacity, closed common areas, and reduced capacity at food courts. And then tier 3, open indoors with modifications, closed common areas, reduced capacity at food courts. And then finally, the minimal category, they're open indoors with modifications and reduced capacity at food courts. So you can see it's not just food, malls are now allowed versus not allowed. There's gradations of capacity and which components of that industry are able to function at what level, depending on the conditions on the ground that feed into those tiers. So I did want to take a moment to put up on the screen so that people can capture this, and we'll make sure to get the information out on our website as well. But all of this information you can get to from this first link up here, which is covid19.ca.gov. That's the state's main COVID-19 website. It's been significantly revamped as of the governor's announcement. You can also get from there, you can get to the map and interactive tool. So you can see the link here. There's also industry guidance. The industry guidance has been updated to break down. The guidance documents themselves are not different, but the page that links to them indicates the percentage capacities at the different tiers and some of this additional information, and I'll show you that in a moment. And then a lot of that can be pretty hard to digest piecemeal like that. So they have created a matrix view, which I will also put up on the screen. And then there's also a link that shows the detailed description to the framework. And then, as I mentioned earlier in the presentation, there's this is a local resource, but there's this COVID-19 recovery email address that you can email if you have questions and you're not understanding what's out there, and you need our help figuring out how your business fits into this, this framework. So with that, I would like to I'd like to take a second just to show you on my screen, or on the screen, what those different links look like, so that we can, so that you can see what's out there. So I will attempt to use the screen share function again. All right. Okay, thank you. So this is the main COVID-19.ca.gov website. You'll a variety of of useful tools and information are available out here. You can see the information about COVID-19 within the state. Then if you click on what's open, that was the second link that I had up on the screen previously. You can see this definition of the tiers. You can see this map, the interactive map that allows you to click down and drill down on an individual county. And then up here, there's a useful tool where you can type in the name of your county, and it'll tell you what tier you're in, and then it'll tell you for each industry, just in broad strokes, what that looks like, as with a link out to the industry guidance as well. There is, and this link was up on the screen as well, and I can put that back up or put it in the chat, but there's also this matrix view that they've put out there that shows in a much more digestible format, I think, with the sectors on the left side and the tiers on the top, and shows you sector by sector what's open at what capacities in each place. And then the industry guidance additionally has been updated so that if you scroll down to the relevant sector for you, let's say retail, you'll see that they've now broken out by tier status what you can do within each of those different tiers. And then finally, there's a very detailed explanation of this framework that you can go out and review rather than having to memorize this presentation. Let me stop sharing for a second here. So I believe one of the key benefits of this tiered framework that they're putting out is that we can see what's ahead of us. We can see what it takes to get there. What this really does is, as they said, creating this light at the end of the tunnel allows the counties to, rather than trying to play the guessing game, what's going to open next, when's it going to open, we see exactly what we have to do to get there. And then the onus is on us as a community and as leaders in the community to embrace that containment, and harm reduction strategies are the key to allowing us to maintain the criteria that we need to advance to the tiers that are going to allow more businesses to operate at a higher level. And so a lot of that involves embracing the harm reduction strategies that we all are coming to know so well. And so I'd like to just invite Jill Blake, our Public Health Director, to speak a little bit about those strategies, fill in any gaps that I may have left in my overview, and then we'll go from there.
Thanks, Ryan. And I know you have all heard these before, and still I'm going to walk you through them. The harm reduction strategies are what we refer to often as NPIs, or non-pharmaceutical interventions. Fortunately for all of us, it doesn't take rocket science for us to really work to contain this disease, but it does take all of us working collectively together to do so. We know that physical distancing works. We recommend 6 feet between you and others. That's based on science, that's based on data, because it doesn't seem that the droplets can carry that far. So the chances of infecting somebody are much more slim. We want to remind everyone to wash your hands for 20 seconds. 20 seconds sounds like a short time, but when you're in the middle of doing it, it seems like it takes forever. We ask everyone to try to recommit to that, sing a happy birthday song, do what you need to do to get yourself through that, but it really will make a difference if you are washing your hands that thoroughly. We're asking everyone to wear face coverings in public, especially when you're likely to encounter others. If you're hiking in the mountains, if you're not around other people, I don't think you have to consider it in the same way. But if you're going to encounter others, if you're walking down the street in downtown Grass Valley or downtown Nevada City or downtown Truckee, please wear a face covering. There is data to support the wearing of face coverings. And if you go to the website that Ryan mentioned earlier, the mynevadacounty.com/coronavirus, we have a flyer that you can see there, masks make a difference. And the last page of that flyer includes links to data, so you can see what the recommendation is based on. We want to recommend that everybody get plenty of rest, maintain a healthy lifestyle, keep your immune system strong. And we want to ask everyone still to avoid non-essential travel and non-essential gatherings. And if you are feeling even slightly sick, please stay home. I can tell you that most of the cases that we've had here in Nevada County in the past month have been due to gatherings of individuals, as well as people going to work while they're symptomatic. so many people say, I didn't think I was that sick. It didn't occur to me. So we're asking everyone to just have it occur a little more soon. I will share with you that the State Department of Public Health and the Governor's Office have put together ads that they're putting out that focus on gatherings, and they're slightly threatening, I would say, that those are the perfect environments for coronavirus to thrive. So they're warning people against doing that. And then maybe the only other thing to share is that the governor also announced that they have partnerships with digital platforms so that businesses that are taking those protective measures can both advertise that to communities, and then customers can also can review businesses based on the protective measures that they're taking. So it allows businesses to share with the community, and then the platforms that they're introducing will allow community members to share with one another, hey, I went to this local business and they're doing a great job, or hey, I went to this restaurant and it felt like the perfect environment, I felt really safe. So they're partnering with Yelp, they're partnering with Facebook, with OpenTable, and Google. So I haven't seen that roll out yet, but I think that will make everybody feel a bit more empowered. So those basic precautions, and then good communication between all. I think that's it.
Thank you, Jill. There's a question in the Q&A that I just wanted to very quickly address, because I did not talk about going what it takes to go backwards through the phases. So it's similar to what it takes to go forward through the phases, where if you've met the criteria for a more restrictive phase, if your data is going in the wrong direction for two weeks, then you could be placed back into a more restrictive tier. And I think that really underscores the importance of Jill's message. In a small county such as ours, it only takes one large dance party to skew our numbers in a way that could potentially jeopardize our businesses and require us to either be in a more restrictive phase for longer, potentially even move backwards. And right now we're so close, we're right on the cusp for being in a category that only 1% of the whole state is in. So we're doing really well, and really hopeful that everybody can embrace that message. So just now we see what we need to do to move forward there. Before getting to other questions, I just wanted to kick it over to Amy, who can talk a little bit about what this means for restaurants. I also can bring back up on the screen the specific sector guidance. So Amy, after you address that, then I'll pull back up that guidance, the sector by sector breakdown, and just go through a little and touch some of the high points, and then we can really jump into the Q&A.
Great. That sounds great, Ryan. Thank you. And thank you, everybody, for being here. I just want to reiterate both what Ryan and Jill have said. The more that we do this together and put in those preventative measures, the greater opportunity to move into that fantastic moderate tier is where we're shooting to go. So for all of you folks out there in the retail food industry that have joined us, thank you for coming and taking the time to be with us today. One of the important things is now we're moving into 25% indoor capacity. So that means that is included. You can still do your outdoor dining, and now you can move a little bit indoors with that 25% of your footprint. I've created a kind of a little cheat sheet or a guide to help you. It's simply meant as a guide, and it's very assumptive or presumptive of the number of tables you have, but you could base it on your permit. We permit you by number of seats. So as an example, if you were a facility permitted 1 to 15 seats, we're making the assumption that, let's say you have 8 tables, 25% of that would be 2. So we're suggesting you have 3 tables or less set up for indoor dining. If you have a larger footprint though, please contact Environmental Health. We will come out, make appointments with you, walk through your facility and see what's feasible. In this particular tier, it's 25, max 25% of capacity, or 100 people, whichever is the fewest of the two. So the fewer of the two is the category you fall in. But again, we're here to help you, so please reach out and we'll walk you through that process. Thank you.
All right, thank you, Amy. I'm going to attempt the screen share again and just bring up this sector by sector guidance so we can just walk briefly through this, and you can, to me, it's much easier to see it than to hear it. So one thing that was kind of a headline out of the press conference on Friday was that hair salons and barbershops are actually open indoors with modifications throughout the whole state and all the tiers. And when you're looking at this document, what you can see is this highlighted, the shaded column indicates that it's new. And then when that same when those same factors are repeated in the next column, they're in white. And so you'll see hair salons and barbershops are open similarly throughout these tiers. If you go down to retail, they're open indoors with modifications at 25% when you're at tier 1, 50% at tier 2, and then open indoors without a capacity threshold, but with modifications in place at both tier 3 and tier 4. So this retail includes critical infrastructure except for grocery stores, and that is a point of a bit of confusion. There is, particularly if you're using the tool where you can put in the county name and it shows you what's open and what's not open, there are some inconsistencies that we're still working through with the state. One of them is grocery stores, where on the state it says that they're open at 50%, or on our side it says 50%, but this clearly says they're exempted, and if you go out to the industry guidance, it says that at tier 2 that there's not a percentage capacity. So a little bit of confusion there, but by and large, it's consistent between all these sources. Shopping malls and destination centers. So again, a similar framework of 25% capacity, 50% capacity, and then the capacity limit is lifted as you would move through the phases. Personal care becomes open for indoors with modifications at our tier. So that would be things like tattoos and waxing and things like that that are not in the specific hair salons and barbershop category. I don't believe that we have zoos or aquariums. Places of worship, so 25% capacity or 100 people at tier 2, 50% capacity or 200 people at tier 3, and then simply 50% capacity without a hard limit when you get down to the minimal capacity. Movie theaters are outdoor only if we were to go into the widespread category, 25% or 100 people in substantial, 50% or 200 in moderate, and 50% without a hard threshold on people if you get to the minimal criteria. Hotels and lodging really are open similarly to the way they are now, except for fitness centers, indoor pools and spas, which really corresponds to what's in the gyms and fitness guidance. So for gyms, they're outdoor only at tier 1, and then they're 10% capacity in tier 2, 25 capacity with indoor pools allowed in tier 3, and then 50% capacity with some additional components allowed if you get to the minimal tier. Restaurants, which Amy just illustrated, 25% capacity or 100 people, whichever is fewer, 50% capacity if you get to moderate with 200 people or fewer, and then 50% capacity without a hard limit if you get to tier 4. So I'm not going to necessarily read all of these. I will say when it comes to bars and wineries, so wineries would be open indoors with modifications if we got to the moderate category at a certain capacity. Bars are open outdoors if we get to tier 3 and open indoors with modifications if we were to get to tier 4. So we can certainly revisit this and come back if anybody has specific questions about an industry that I did not talk about, but I definitely wanted to take a chance to get to the chat and the Q&A. So Jill and Amy, do you have anything to add before kind of diving into this? And maybe the questions that we answer in the chat, we can answer verbally as well. I don't know if everybody can see this or if it's part of what's being recorded. But Jill, do you want to answer the questions that you took care of in the chat verbally?
Sure, thanks, Ryan. So one person asked about testing at the Vets Hall, asked how many tests per day can be, how many samples can be taken per day, and it's around 130 per day. The follow-up question was, how long does it take to get results? The last data that we got from OptumServe was it takes about 70 hours or just under 3 days for results. And then do you have to feel ill to get a test at the vet's hall? And the answer is no, you do not. In fact, we encourage people to go in routinely. We know that there are asymptomatic people who test positive, and while they may not feel sick ever themselves, they could still infect others. So it's important that people find out. The other question that I answered was, it had to do with how long we remain in a tier. So we remain in each tier for a minimum of 21 days or 3 weeks. So there's no bouncing back and forth quickly, unless you think 3 weeks is quickly. So you remain in each tier for at least 3 weeks. And then as Ryan said, in order to move to a less restrictive tier, you have to meet that criteria for 2 consecutive weeks. And then maybe the other thing to mention that I threw in, even though they didn't ask, was just that counties can only move 1 tier at a time. So it's progressive.
Yeah, sorry for not mentioning that previously. Yeah, the intent of both the 21-day wait period and the 1 tier at a time is so that counties aren't jumping back and forth and creating both disruptions for the business sector as well as potentially creating additional risk in the community. So I see there's a question about limitations for offices. So please jump in if I get any of this incorrectly, Jill or Amy, but the current guidance, and if you go out to that matrix that I had on the screen for offices, it indicates remote work for widespread and for substantial, which is the tier we're in, open indoors with modifications for tier 3 and open indoors, and the same thing for tier 4, the minimal tier. That gets a little bit confusing when you're talking about critical infrastructure versus general offices. So offices that are providing a critical infrastructure service can sometimes by necessity have some in-person work going on there. So is that roughly accurate, Jill?
I think that's accurate, and I think it's actually not dissimilar to what was in place before this. So the state had recommended that if people can work remotely, that they should, with a recognition that not everybody can conduct business remotely, but if you can, you should, and I think that remains the same.
If I might really quick here, Ryan and Jill, I've had a couple of calls, everyone, and Gretchen asked a very good question about weddings and receptions, and we have had some phone calls from caterers as well, wanting to know if they can continue with that. I think the main thing to reiterate to everyone with us today is that the conditions or the requirements for weddings and receptions have not changed. They're still the same, where receptions are not permitted at this time. I've had folks that have said, I'd like to submit a plan to you to show you how we'd lay it out in a COVID safe, possible operation. Feel free to do that, but it's not a guarantee that that would be a go ahead to allow for a particular event to occur. Okay, well, there are times where we're making concessions, working through public health with Ryan, Jill, Dr. Johnson and Dr. Crochet to try to find a way to make certain things work, but it's not a guarantee, and you certainly can reach out with an idea or a plan. I would encourage you to do so.
All right, so there's a couple more questions in the chat or on the Q&A, and one of them just disappeared. So for Jim's, if you have a specific question for your business that you're already working through with the county, we will be in touch with you. I know there was a question related to the Grass Valley Elks in the Q&A, and we've received inquiries about that. And on a case-by-case basis, when you're not sure what category you fit into or how exactly this applies to you, we'd be happy to work through that with you. Just email that COVID-19 recovery inbox. So there's a question about gyms and fitness centers. Is there flexibility with capacity guidelines based on size of indoor square footage? Please chime in, Amy or Jill, if you have something to add to this, but I would say that right now the guidance isn't a hard and fast number of people, it's percentage, so it's inherently scaled to the capacity of the facility. If you can fit 400 people and operate at 10% capacity, then you can get 40 people in there, or 100 people once we advance to moderate. So I hope that answers the question, and please feel free to submit something else if that didn't get to it. So what tier would a reception fall in? I think that's similar to the question that you answered, Amy, that currently under the guidelines for weddings, a reception is not something that's allowed. I don't believe that that's something that's anticipated in one of the later tiers, but correct me if I'm wrong, Jill or Amy.
You're right, Ryan.
So there's a question, is there a possibility that a county might be moved back to a previous tier, example from orange tier back to red tier? And yes, that there definitely is that possibility. If we meet the criteria for a more restrictive tier, even just one of the criteria for 2 consecutive weeks, then after having been in a tier for 21 days, we could be moved backwards. So it's not immediate, there's some stability, but yes, absolutely. We could move forward and backwards through this depending on what how successful we are at containing COVID within our community.
Can I just say, Ryan, that I think we'll be doing our best to communicate to everybody, and you can also check that interactive website that Ryan pulled up so that we can all stay informed. And if we do move backward or forward, it shouldn't be a surprise because we will have a sense that we've been either meeting criteria for 2 consecutive weeks or not meeting criteria for 2 consecutive weeks. And ideally, having this plan before you will help everybody plan for what that might look like. So what does diminished capacity look like? What does increased capacity look like? So as Ryan said, hopefully it takes the mystery out of it. Not that it's welcome, but it should be simplified.
Great. And then an anonymous attendee asked if they see 100 people attending private wedding venues, is that okay? And so for a wedding ceremony, 25% capacity or 100 people, whatever is less, is allowable. But for a wedding reception, that would not be allowable. And we do have an enforcement process where you can go out and report if you know of gatherings in real time or before, in particular, would be helpful. But so if you're talking about ceremonies, potentially, yes, 100 people could be there. If you're talking about receptions, no. Additional question, and I want to check in the chat as well as the Q&A to see if there's anything out there, but will this also continue through winter? What are the additional health criteria you mentioned at the beginning in addition to the county threshold? So the intent is for this to last through winter and to get us through the flu season. And so the criteria for health, and Jill, you can jump in with any additional information you have, is really around the new cases per 100,000 people. So we're roughly 100,000 cases, so that translates pretty well for us. And then the positivity rate, which is our percentage of cases that are testing positive. And so the threshold for us to advance tiers, we need to get below 4 cases per day, and that's a weekly average with a 1-week lag. So over the week period for the data that they're reporting, we have to have averaged below 4 cases per day for 2 consecutive weeks before we move into the next tier on the new cases threshold. And then the positivity rate is we're already in the moderate tier on that, but it's basically the percentage of tests that are positive, and we're at 2.2%, I believe it is. The moderate category is 2 to 4.9%, and both of those underscore the importance of increased testing. So anybody that's on the call, get out to your networks. Please go out to the LHI site. You can link to it from our website and register for testing because the fewer people are getting tested, the higher percentage of them are symptomatic people and sick people, and so our positivity rate can certainly go up. And then if we do test at high levels, we get a bonus in terms of our new cases. So that's, sorry to reiterate all that, there's additional factors. So if they're not completely abandoning the idea of hospital capacity, that's still very important. And so if they see a particular issue there, though they're not trying to codify that for the state, it's really gonna be a conversation with the county health officer and those involved to address that situation on a case-by-case basis. So I hope that answered the question, and Jill, please chime in.
I was going to say the only other thing you mentioned at the beginning was that the state is going to at some point add a health equity metric, and that hasn't been defined yet.
Okay, thank you. So the next question in the Q&A is, why are churches still restricted to 50% attendance if less than one person per 100,000, basically 0 test positive? So, well, I would take issue a little bit with that statistic of 1 person per 100,000. We're getting quite a few tests, positive tests every single day. But I'm definitely not going to try to get into the why of what the governor or the state are thinking, other than to point you out to the website where they have listed out their considerations for developing these tiers. If you go out to the website that I indicated that gives the detailed overview, they have a bulleted list of what their considerations are. But as to that specific criteria, I'm not 100% what their thinking is. Okay, let's look at the chat a little bit. I don't know if people have been submitting questions through there. Is it all Q&A or is it in the chat as well?
Maybe Ryan, just in that last question, I know that we're not getting into the details of it, but I do just want to say that this new tiered system is risk-based. So the epidemiologists that study disease transmission and disease prevention looked at the different settings and determined level of risk. So I can just say that those level of risk did inform the categories, the percentages of openness, or the percentage of capacity in terms of openness. And as Ryan indicated, you can find more detail on their website.
All right. Yeah, the dashboard you shared on screen showed that Nevada County Matrix is available online, so we can determine if there is slipping back. Yes, as I mentioned, one of the advantages of this is that they're doing a transparent reporting, where the same data they're using for these categories are going to be the data that's out there on the dashboard. And so if you go to that covid19.ca.gov, it's easily accessible from there, and you can see the color-coded map, drill down on it, and as well as use that tool where you can see sector by sector in Nevada County or other counties what's open. In terms of the chat, it looks like we have a question from Camp Del Oro. We're an organized camp and fit within several different categories. If we keep indoor common areas closed, we have enough space where guests could have their own room. The indoor dining combined with our outdoor dining would allow us to hold a small group. We also have a large room where a place of worship could happen with under 100 total people. My question is, are we allowed to now operate and hold overnight guests, with each guest having their own room if we follow all these guidelines? So I don't know if either Jill or Amy can speak to that specific situation. If not, I would suggest that we follow up offline and work with them on their specific proposal and how that might fit within the guidelines.
I think that would be helpful. I'd hate to misspeak, and it sounds like there's a lot going on in this one place, which is fantastic, but I'd want to make sure that we're giving the right information.
Yeah, I would agree with that, Ryan. And Nathan, if you want to reach out, you can reach out to me, and I have a couple of staff that can help you through that as well.
Yeah, and I think that also speaks to the, it's the same individual actually that's in the Q&A, so we can remove that question. So then we have another question in the chat from Cynthia Coleman. I have a farm for seeing animals and a farm store. Can I open and allow just one family at a time, which is far less than our capacity? Okay for us to open following guidelines? Anybody have?
So open a store? If it's retail, I mean, it says retail can be open, yeah.
It looks like it's a farm for seeing animals and a farm store. So
Yes.
it sounds like potentially, but we'd be happy to, if you have something other than the farm store that you're planning to do in with your business, then please feel free to reach out to us and we can help you with the specific proposal.
Yeah, I would agree,
Yeah.
Cynthia, especially if you're going to have any kind of interactive play or kind of interaction with the animals for the guests. Let's talk about how you'll make that happen, so we can make sure we cover everything.
Okay, well, doesn't look like we have any more questions in either the the Q&A or the chat. So if any more trickle in, we can certainly answer them. And then if Jill or Amy, you have any final thoughts to share or additional information to provide, we can kind of jump into that.
I don't have any additional information to provide, but I just want to thank everybody for participating today, because it's a situation that has evolved so dramatically in the months that we've been in the midst of this event. And we know that everybody has had to pivot and repivot, and just thank you for your work in doing so, for your attempts to do so, for your commitment to doing things right, to protect this community and to help to decrease our case rate and our transmission rate. So just thank you to everybody for all your hard work and for the sacrifices that you're making while you're doing that.
Yeah, and I would second that too. I know our industry personnel have really worked hard. A lot of you have made a lot of adjustments for your indoor when we were dining in for COVID safe, operations and working on your structure to make sure your facility. So a lot of you already have a plan in play. It's just a matter of moving into that 25% max capacity or 100 people, whichever is the lesser, to make it work. And again, we're here to help you, but I know that it's been a roller coaster, and we've been right along that ride with you, all of us on this call today, and everybody here working hard for you at the county. So we're here to help you, and please do reach out. And I see Ryan, really quick, looks like Liz Wainscoat has her hand up. I'm not sure if what we can do. So
No, I would have to call on one of our Zoom experts to see if we can allow that person to submit a question. Yeah, I believe that this is if they can submit their questions through the chat, then we'd be happy to address them, and we can stay on for a little bit. But this chat isn't set up to take verbal comment. Okay, well, Jill, I can't, if you're talking, I can't hear you.
Sorry, thanks, Ryan. There is a question in the Q&A asking if you base code capacity or capacity off of code capacities. I think the answer is yes. Yeah.
Okay, well, we can kind of stay on for a little bit longer, but I would just say that I know that there are some people that aren't going to be terribly thrilled with the thresholds, or you may be disappointed that your sector isn't open yet. But I think that there's some things to like in this framework. We can at least see what the criteria are. We can see what can be opened if we can get our criteria or our conditions to the right point, and we can really embrace as a community the need to for us all to work towards those goals so that more of our businesses can be open to a greater extent. If people are having trouble digesting this information, or you're not sure how it's working, it's going to work for your business specifically, please reach out to us through that COVID recovery email address. Again, I'll just put up, as we close out, I'll put up the screen that has the links on it, just so that people can take one last opportunity to jot that down, and then we will adjourn the meeting if there are no other questions. That is not the one that I meant to put up. So let's see. Do you see the PowerPoint?
Yeah.
Okay. All right, so we are going to adjourn this meeting. Thank you, everyone, and please reach out to us if you have any questions.